the plan that we had was now blown to smithereens because of all the unknowns. Until you begin to understand this disease, it's like there's just a black cloud, a fog, just hanging there.
I had the flu, got on medication, seemed to recover, but the lymph nodes were swollen because of the flu and didn't seem to go down. When I went to see the hematologist, they did blood work and basically provided the diagnosis of chronic lymphocytic leukemia. The plan was we would relocate to Colorado and we would go back and forth to Duke every 3 months, and then I would find a doctor here that would kind of be my liaison. Once we got here and I met Dr. Kamdar, we walked out of the room and said, we don't need to go back to Duke. This doctor is on top of it.
Mark and Dr. Kamdar just hit it off, and they were like eye to eye, nose to nose, discussing what's happening in the world of CLL, that it was like, we're gonna be great here.
Prior to 2014, patients with chronic lymphocytic leukemia were historically treated with chemotherapy. And chemotherapy worked in only 20% of patients with CLL. At that point in time when I had seen Mark and Sharon, thankfully Mark did not require therapy. CLL is a chronic disorder. We offer treatments when treatments are needed. We had more data that was generated off of the clinical trial that was open at Anschutz. I knew that the second generation drug worked. And then finally, because of the clinical trial at Anschutz, about 3 years later, it got FDA approved. And right then, Mark actually needed treatment.
We were both dreading the day that we would go see Dr. Kamdar and she would say that it's time to start treatment. Because with many diseases, it's like things are so bad, now we have to give you something for it because this is the beginning of the end. So I don't think we realized that treatment wasn't the beginning of the end. It was the beginning of the attempt to get life back to normal.
This second generation inhibitor has worked wonders for Mark.
I could see the results of the trial that had been done. People were doing fine. 80 to 90% of them had a survival rate for 3, 4, 5 years. I think there was a reassurance that I'm going to be one of those 80% that's going to be fine for 5 years or 10 years, or maybe longer.
His journey with the CLL has been very similar to anyone else's journey with another chronic medical condition, be it high blood pressure, be it diabetes.
I take my pill twice a day and I move on. I don't know what the end is. I just know that there's additional treatments. And if and when this fails, there'll be something there because people like Dr. Kamdar are doing the research to help make that happen.
Of the 10 or 11 trials that we have opened, we have so far had FDA approval for nearly 80% of those trials, which means our patients were fortunate enough to get on those studies at least 4.5 years earlier than when the FDA approved it. I have not prescribed chemotherapy since 2014 for any patient with chronic lymphocytic leukemia. So truly believe that clinical trials is the key to curing cancers.
This is the hub of research in the whole Western United States. It's the personal thing too when I come here. It's just, I feel very welcome. And to knowing that it's personal, but I also have access to the latest, greatest, best research that's going on in not only Colorado, but the whole United States.
This is simply an amazing place, and it's truly humbling as far as there are individuals, many individuals like you, who are working on so many things to make life better for us.
I want to also say how inspiring Mark and Sharon are to me and my team. There are many, many Mark and Sharons in our clinic, wherein initially the conversation was around their journey with lymphoma. And now the conversation is around how many trips have they taken, what is on their bucket list, what do they want to do, have they been able to meet their kids, have they had fun? And that is the most gratifying part of my journey as a physician.